questions or comments as I'm moving through things, feel free to drop them in the comments or email our office directly and we will get back to you. So to start, you might have seen this because we posted it on Facebook last week, but just to re-up it, we introduced bills that would exempt menstrual products from the sales and use tax in Michigan. That was with Senator Brinks and then House colleagues, Representative Kupa and Yancey. So menstrual products are medically necessary for people who menstruate. In Michigan, medically necessary products and equipment are currently exempt from the sales and use tax. So this would just bring those products into that category where they should be. 20 other states have exempted this tax. So it would also bring us in line with a lot of other states who have already done this. And the governor also in her budget recommendation earlier this month, which we reviewed a couple coffee hours ago, had put in funding to cover the loss of revenue to support this tax exemption. So we're excited about reintroducing it and we hope that it will see some movement. Other big thing from this week was the introduction of the Hardworking Michiganders Recovery Package. So this was a package of bills that Senate Dems put forward that would fill in some cracks that were illuminated during the pandemic in Michigan's unemployment system. So that these are Senate bills 168 to 176. We will put a link to the Michigan legislature's website in case anybody is interested in diving deeper into the specific bills or reading them, but I will do a summary for anybody who does not want to do that. So to start, Senate Bill 168 increases the weekly benefit amount from 4.1% to 6.1% of a worker's highest quarter earnings. So right now, Michigan has actually one of the lowest benefit amounts in the country. Families right now are obviously struggling more than ever in the pandemic. So this boosts that amount, help people stay afloat and get back on their feet. Senate Bill 169 increases the weekly benefit amount's maximum rate from $362 to $593. That $362 has not been adjusted for nearly 2 decades. So it's like way past due to increase that. Senate Bill 170 restores the maximum benefit week to 26 weeks. So this has been a big part of the conversation coming out of COVID. In Michigan, 26 weeks was the maximum benefit week until 2012, and it was dropped down to 20 weeks in 2012. When the pandemic hit, the Federal CARES Act implemented the 26-week maximum benefit week kind of nationally. So in order for the state to get some federal funds for unemployment, we boosted it to 26 weeks. This bill would codify that 26 weeks and restore it back to what it was prior to 2012. Senate Bill 171 makes it so low-wage, part-time, and wait staff workers are eligible for unemployment because Michigan has one of the highest quarter earning requirements in the country. It leaves a lot of low-wage and part-time workers ineligible. So it makes it so if there is a job loss for individuals or families who are low-wage workers or part-time workers, wait staff, that sort of thing, it just kind of plummets them further into poverty. So this would create a safety net for that population. Senate Bill 172, which is a bill that Senator McMorrow sponsored in this bill package, makes it so independent contractors are eligible for unemployment benefits during state-declared state of emergencies. And then it also redefines how we determine an independent contractor. So, our labor market is shifting more and more towards gig workers and a gig economy. And we kind of saw this as a major issue during the pandemic, that a lot of independent contractors, gig workers were left in the dust because they were not eligible for unemployment. So this fixes that. Senate Bill 173 removes a section of law that disallows seasonal workers from being eligible for unemployment benefits during an off season. 174 allows low-wage school employees, so this would be maybe parapros, bus drivers, cafeteria workers, to be eligible for unemployment benefits. Senate Bill 175 expands who can collect unemployment benefits during a pandemic. So this codifies one of the executive orders from last year, and we will post that in the comments below for anybody who is interested in seeing what that expansion covers. And then the last bill in this package, Senate Bill 176, ensures that only the separating employer will be used to determine non-monetary disqualification for benefits. So this was a problem, again, that was brought to light during the pandemic, is most of these things were that previous employers in an unemployed workers base period were holding up and disqualifying those workers from getting unemployment. So this again fixes that problem and that crack in the system. So we are hoping that this will gain some traction and move. There are a lot of things that need to be addressed in our unemployment system and unemployment agency. So this is a good step in starting that conversation, and hopefully we'll continue. The other big thing from this week, yesterday, the Senate put forward a couple supplemental bills to distribute a small portion of the federal funding available to Michigan for COVID relief. So I'm sure almost everybody has heard something about the frustration surrounding the lack of distributing these federal funds that are available to us right now. So the legislative majority in the legislature has been withholding distributing like billions of dollars in federal funds because they want the governor to relinquish any of her ability to make decisions about COVID mitigation efforts and to, limit the ability of the Michigan Department of Health and Services department to put forward mitigation efforts. So it's, purely political, really disappointing. This is money that our schools need, that our businesses need, and our, cities, communities, families. So we are hoping that this will move forward in a healthier direction than it was yesterday. But to give a little bit of background, so Governor Whitmer had put forward about a $5.6 billion plan to allocate this federal funding. And so this would be money that would go to schools and school districts to get ready for in-person learning. Again, small business relief, unemployment, vaccine distribution, and that sort of thing. So the House put forward a plan that allocates about $3.5 billion. And then the Senate plan, which is what was talked about yesterday, allocated a mere $2 billion. So again, this is federal funding that is available to us, free of charge. And there is no reason why we should not be using it. So the bills yesterday in the Senate passed along party lines for a number of reasons. There is a fundamental issue with the bills. As I mentioned before, withholding billions of dollars of funds makes the money not as impactful to residents, communities, schools, when we really could be helping a lot more than what these bills allowed. And then it also removed the Social Vulnerability Index and other scientific data measures that guide informed vaccine distribution, which was a huge concern. So as our colleague Senator Santana had said on the floor, these bills are past due and they're incomplete. And I think that that is a really good kind of summary of the problems with those bills yesterday. But I do want to address something that came out of some of the debate on the Senate floor that was really upsetting and really disappointing. So the social vulnerability index ended up being a super contentious part of this conversation and this debate yesterday. As I had mentioned, it was taken out of the bills, and so there was amendment that would put some data-driven measures back into these bills. Social vulnerability index is something that gets vaccines to the most vulnerable in our state, and therefore helping to mitigate the spread of this virus. It's been part of the CDC's guidance to ensure we're distributing vaccines in the most effective way, which will get us back to some semblance of normalcy in the safest way possible. Yesterday, a couple of our Republican colleagues argued adamantly against using this metric, using the city of Detroit as a shield for just blatantly racist pushback against a scientific metric that's been used since the 70s. The Social Vulnerability Index is not new. And it's a number of factors. It's not just race. It is poverty, maybe lack of transportation, housing, that sort of thing. And so I want to be clear about the consequences of this type of rhetoric, because not using something like the Social Vulnerability Index not only hurts communities of color, but it also hurts vulnerable low-income white residents who will get sick and die unnecessarily because Republicans don't want to use race data or anything that could allude to that in how we're distributing vaccines. So not using that hurts everybody. And it's really disappointing because it is for racist reasoning. And that was just really upsetting to me, because I think that it is possible to advocate for your community and residents without scapegoating others. And I just would hope that moving forward, when we are debating and talking about the best way to tackle COVID, because it is still very much here and impacting our communities, that we do it in a way that makes it so we are all in this together, because we are. And that is how we should be creating policy around getting resources to our communities and our schools and our businesses, so that when it is safe, things can successfully reopen and get back to normal and all of these things. So there was a lot of just kind of blatant lies about the Social Vulnerability Index yesterday, a lot of misguided rhetoric. So we are going to post in the comments below the CDC's guidance surrounding the Social Vulnerability Index, just to give some context, and a couple of other resources about why it's important and how it is used. And so just to kind of make sure that anything floating around out there that is false can get debunked. So that is main things from the last about week and a half legislatively. Again, if you have any questions about anything that I reviewed today, feel free to comment or email us and we'll get back to you. And I hope to see you next week.